Welcome to our smoking cessation class. This presentation is presented by Ascension Saint Thomas Cancer Care. My name is Claudia Fantuzzi. I'm a nurse navigator for lung and colorectal cancer at St. Thomas Rutherford Hospital. I have over 9 years of experience working with cancer patients. You did the first important step today by deciding to watch this presentation to get some valuable information on how to stop smoking. There's many reasons for quitting. Maybe your doctor told you that you need to stop smoking for medical reasons, or you always wanted to quit but just didn't know how, or your family and friends have bothered you and said, please quit, or smoking is just getting too expensive for you. Smoking cessation is not something easy to do because it comes with nicotine withdrawals. The symptoms of nicotine withdrawals are nicotine cravings, depression, anxiety and restlessness, irritability, difficulty concentrating, sleep problems, appetite, and weight gain. But there's a lot of health benefits when you stop smoking. Within the first 20 minutes after stopping smoking, your blood pressure and pulse drop back to normal. Your hands and feet are warming up. After 8 hours, your carbon monoxide level in the blood drops back to normal, and your O2 level in the blood increases back to normal, and you feel more energetic. After already 24 hours, your chance of heart attack decreases. After 48 hours, the sense of taste and smell improve, and your nerve endings start to regrow. After 72 hours, the bronchial tubes in your lungs start to relax. Between 2 weeks to 3 months, circulation, lung functions, and stamina improve. And within 1 to 9 months, coughing, shortness of breath, and sinus congestion decreases. After 1 year, the risk of heart disease drops to half of that of a smoker. At the 5-year mark, the risk of stroke is the same as that of a non-smoker. The risk of cancer of the mouth, throat, esophagus, and bladder are cut in half. And for women, the risk of cervical cancer is the same as of a non-smoker. At 10 years, the lung cancer risk is half that of a smoker. The risk of pancreatic cancer is about the same as a non-smoker. And precancerous cells in your body are being replaced with healthy ones. Last but not least, after 15 years, the risk of heart disease is the same as of a non-smoker. The risk of death is nearly the same as of a non-smoker. Why is it so hard to quit smoking? Because smoking is an addiction, and it can be divided into physical dependency and psychological dependency. For physical dependency, we recommend the use of smoking cessation medications, or a few of us are able to just go cold turkey and stop smoking without any intervention or help. Today, I would like to present a variety of smoking cessation medications. These medications help you to control your physical dependency. Studies have shown that smoking cessation medications can double or triple your success to stop smoking. Most of these medications are considered safe and effective, and the chance of overdose is low, and only if the medication is not used as directed. So, what smoking cessation medications are available on the market today? We have nicotine patches, nicotine gum, nicotine lozenges, nicotine inhaler, nicotine nasal spray. We have Wellbutrin and varenicline. How do all these medications differ from each other? Well, some are long-acting and others are short-acting. The effect of long-acting medications tends to last longer than the short-acting ones, and they don't have to be taken as often. Some of these medications are available over the counter, and others require a prescription from a doctor. Some are considered non-nicotine medications, and others are nicotine replacement therapy. Both types of medications can reduce the withdrawal symptoms from nicotine. They can be available under their brand or generic name. Please keep in mind that the generic version can be less costly and most of the time has the same quality and effectiveness as the brand name product. I like to start with the nicotine replacement therapy products. So how do they work? They work by replacing the nicotine from your cigarettes, and that helps to reduce your cravings for a cigarette and also lowers the withdrawal symptoms. A lot of people wonder if they can get addicted to this kind of medication since it contains nicotine. The answer is that most people do not get addicted since it only contains a lower dose of nicotine. It also takes the nicotine in the medication a much longer time to reach the brain than by inhaling it through a cigarette. All of these medications are available over the counter. I'm starting out with the first product, which is the nicotine patch, also can be found under as Nicoderm, Nicotrol, Habitrol, and other generic names. It is long-acting, and it is an adhesive that slowly releases a steady amount of nicotine into the body through your skin. It helps to reduce withdrawal symptoms and slowly gets you off the nicotine. It is available in different strengths in 7 milligrams, 14 milligrams, and 21 milligrams. So what is the right dosage for you? The first step, which is step 1, contains 21 milligrams, and you should use that product if you smoke more than 10 cigarettes a day. Step 2 contains 14 milligrams, and you should use it if you smoke 10 or less cigarettes a day. Step 3 is 7 milligrams and is to be used after completing step 2. How do I apply the patch? Please do not place the patch on your head, face, or neck as they can cause severe redness. Do not place the patch directly over your heart as the patch is transdermal and could enter the bloodstream too quickly. It is recommended that you should place the patches anywhere between your neck and the hips to allow for adequate absorption of the nicotine. Put a new patch on every morning after you've taken off the old one. Wearing more than one patch at a time is not recommended and can lead to severe side effects. Do place the patch in a different location each day to avoid redness and itching. I always recommend my patients to, if they place it on the left arm, the next day place it on the right arm. If it's on the left shoulder, place it the next day on the right shoulder. Also, please do not use nicotine patches if you're pregnant. Possible side effects of nicotine patches could be dizziness, diarrhea, headache, upset stomach, vomiting, redness or swelling at the patch site for up to 24 hours, and itching, burning, or tingling where the patch is applied. The next product is the nicotine gum, also known as Nicorette or other generics. It is short-acting and is a gum-like product that delivers nicotine through the lining of the mouth. It helps to reduce the nicotine cravings and is available in 2 strengths, 2 milligrams and 4 milligrams, and also several different flavors. It can be used in combination with other smoking cessation medications. How do I use the gum? You take one piece of the gum from the package and put it in your mouth. You bite into the gum and chew it slowly until the gum tastes like pepper or any other non-favorable flavor. Then you put the gum between your cheek and the teeth, and you repeat the same process when the taste goes away. Please make sure that you throw the gum away after 30 minutes. Side effects of nicotine gum could be throat irritation, increased salivation, taste disturbances, nausea, headache, cough, stomach discomfort, and mouth ulcers. Another product is the nicotine lozenges. They are also short-acting, and they are actually hard candy that delivers the nicotine in the mouth. They are also available in different flavors and strength. You can have them in 2 milligrams or 4 milligrams. You can place that lozenge in your mouth and let it slowly dissolve. It should take about 20 to 30 minutes. Please don't chew or bite on the candy. Most common dose is 2 milligrams, but if you tend to smoke 30 minutes right after waking up in the morning, please start out with 4 milligrams. This product is meant to be used for 12 weeks, and it is also safe to be used with other smoking cessation medications. Side effects could be sore throat, nausea, indigestion, heartburn, and hiccups. Nicotine inhaler is also known as Nicotrol inhaler, and there's no generics available. The inhaler is short-acting, and it is actually a plastic tube containing a nicotine cartridge, which delivers nicotine vapor to the mouth. It is not an e-cigarette, but some people find it very satisfying since it copies the hand-to-mouth behavior of smoking. How to use the inhaler? You take one cartridge out of the package, you put the cartridge into the inhaler device and push the pieces together. Then you twist so that the markings don't line up. Gently draw air into your mouth through the inhaler, puff into the cheeks, but please don't inhale it deeply. Then hold the vapor in your mouth for a few seconds before breathing out. Possible side effects of the inhaler could be fast or irregular heartbeat, fever with or without chills, nausea, vomiting, runny nose, skin rash, itching or hives, tearing of the eyes, tightness of the chest, and trouble breathing. Another product is the nicotine nasal spray, also known as Nicotrol NA, Nicorette nasal spray, and there's no generics available. The product is short-acting and delivers nicotine into the lining of the nose and it reaches the bloodstream faster than any other nicotine replacement therapy product. How do you use the nasal spray? One spray in each nostril equals one single dose. So you start with 1 to 2 doses per hour. You should use the product for up to 8 weeks. And please don't sniff, swallow, or inhale. Do not use more than 5 doses per hour or 40 doses per day. Possible side effects are runny nose, sneezing, and coughing. Now I'm going to talk about non-nicotine medications. These type of medications, you will need a prescription from a physician. There's 2 types. There's the Wellbutrin and the varenicline. The Wellbutrin SR is long-acting. It is often used to treat depression, but also to assist with smoking cessation. It acts on the chemicals in the brain that are related to the cravings for nicotine. It has the same success on people with or without a personal history of depression. How do we use the product? You start taking the medication 1 to 2 weeks before you want to quit smoking. You should take it daily as prescribed by your doctor. Please don't crush the tablets and avoid drinking alcohol by taking it because it may increase the risk of seizures and addiction. The product needs to be used for at least 12 weeks, and it is safe to be used in combination with any other type of nicotine replacement therapy. Possible side effects. The common ones would be dizziness, headache, nausea, insomnia, constipation, and dry mouth. The more severe ones are vision changes, confusion, irregular heartbeat, skin rash, menstrual changes, and seizures. Please contact your healthcare provider if you experience any of the severe side effects. The next drug is the varenicline. It is long-acting, and it interferes with nicotine receptors in the brain to reduce the pleasure effects of smoking and assists with easement of nicotine withdrawal symptoms. Chantix was a very well-known name of this type of product. There was a recall of Chantix in 2021 where the manufacturer Pfizer voluntarily recalled the medication due to the presence of nitrosamines, which may have an increased potential risk to cause cancer in humans. Nitrosamines are common in water and foods like cured and grilled meats, dairy products, and vegetables. So an overall exposure to nitrosamines are very common. But the Chantix was meant anyway to be taken for short-term use only. It has been successfully discontinued since its recall, just for safety precautions. However, there are FDA-approved generic versions available now. How to use the varenicline? You should start out the tablets 10 to 14 days prior to the quit date that you have selected. Please make sure you stay with your quit date. Take 1 tablet by mouth on the first day It is best to take medication with meals and a full glass of water. Take 2 tablets each day, 12 hours apart, and use the medication for at least 12 weeks. Try not to abruptly stop taking it, please. Possible side effects are depression, anxiety, trouble sleeping, irritability, frustration and anger, difficulty concentrating, restlessness, decreased heart rate, increased appetite, and weight gain. Here's some additional important information. A combination of these medications usually works better than using just one. It is important to consult with your healthcare provider to find out which combinations are safe to take together and which are best for you. Please read the medication package insert thoroughly and contact your healthcare provider or pharmacist if you should have any further questions. Start taking the nicotine replacement therapy products on the day you selected to stop smoking. For the prescription medications, you should be starting 1 to 2 weeks before attempting smoking cessation. Don't stop using these medications too early. Allow yourself to take them for at least 2 months. How much will all of this cost you? You can check with your pharmacist to see which medications are covered by your insurance. You can choose the generic product or the brand name to keep costs down. You can shop around and you can use an app that's called GoodRx. And remember, you will always save the money you would spend on your cigarettes, and you can use that towards your smoking cessation products as well. If you're not familiar with GoodRx, I'd like to explain to you real quick how that works. So GoodRx is a free app that you can download on your smartphone, tablet, or computer. The drug prices vary by your pharmacy. So you type in your zip code and the app will find current prices and discounts in your area. The GoodRx coupons can help you pay less than the cash price for your prescription. The coupons, however, cannot be used in conjunction with your insurance. So always make sure to see if the coupon is cheaper or if your copay is cheaper. You could present the free coupon at your pharmacist when you pick up the prescription to get your discount. If you have any further questions about this presentation, please feel free to reach out to me. You can email me at claudia.thompson@ascension.org. Thank you.